everyone. For today, I will be discussing the topic Health Service Delivery. I'm Dr. Louricha Opina-Tan from the Department of Community and Family Medicine. The objectives of our session for today are the following. First, to discuss the importance of the health service delivery building block in the health system. We would like to be able to describe the attributes and indicators for good health service delivery. And finally, analyze the different factors that shape health service delivery in the country. Before we start, I'd like you first to answer the questionnaire that you can find in this link, or you can scan the QR code below. So this is a very short questionnaire. It will take you less than 5 minutes to answer, and then your responses will automatically be forwarded to me. So after answering, just go back to this video for our discussion. So during the start of our course here in EHSM, I have presented to you the WHO Health System Framework. So we all know that there are 6 system building blocks, and all of these building blocks would have to work together synergistically for us to achieve the overall goals or outcomes of the health system. And foremost of these building blocks is the service delivery building block, which we'll be discussing for today. So health service delivery is a health system building block that's concerned on how inputs and services are organized and managed. It is important because it is needed to ensure access, quality, safety, and continuity of care across health conditions, across different locations, and over time. Health service delivery is actually the immediate output of the inputs that we have invested into the health system. So the figure here is a framework that shows the monitoring and evaluation of health system strengthening. However, more importantly here in this figure, we can see that the different building blocks that we have mentioned earlier, namely governance, financing, information technology, health workforce, your supply chain for your pharmaceutical products, all of these are actually inputs, no, and processes for our health system. However, it's the healthcare delivery that is what experienced by the patient or the person who have access to the health service. So our output basically would be intervention access and service readiness. And you will see later on how this figure into the framework. And of course, intervention, quality, and safety. All of this will have to come in for us to see the outcomes. This will lead to the outcomes. As we have mentioned in the framework, coverage and prevalence of risk and behaviors, and then eventually will lead to the health impact that we hope to achieve, which is improve health outcomes, not only in level but also in equity, social and financial risk protection, responsiveness, and efficiency. So there are 8 attributes for us to say that health service delivery in a particular area is good. So these are the 8 attributes, namely comprehensiveness, accessibility, coverage, continuity, quality, person-centeredness, coordination, and accountability and efficiency. So briefly, let's go through these different attributes. So comprehensiveness talks about having a complete range of health services across all levels. So starting from health promotion, disease prevention, curative services, um, rehabilitative services, and of course, to include your palliative services. So it does not, your health services should not only focus on the curative aspect of care, but in fact, all of these different levels of care must be available, must be made available for you to say that health service delivery is good in that particular area. Another attribute is accessibility, wherein there's no undue barriers of cost, language, culture, or geography. So, accessibility here does not only mean physical accessibility or accessibility um, issues, not only related to distance, but also it relates to to having services that are culturally acceptable and having services that are affordable to the patient or person. And the routine point of entry is at primary care level. Why is this so? Because we want the services to be available to people where they need the services. No? The services are available at once. So whether they are in the workplace, they are in the community, they are at school. So these services must all be made available and accessible right away. The third attribute is coverage, wherein all people in a defined target population are covered. So it's very popular nowadays, no, what we call as the universal health care, wherein everyone in that particular area, or geographical area, are covered by the health services. The fourth is continuity, and it talks about continuity of care across the network of services, whether the patient is seeking for medical services or the patient is seeking for oral health services or laboratory services or pharmaceutical services. There should also be continuity of care across health conditions, across levels of care, and over the life cycle. Meaning, a patient who's first being taken care of by a pediatrician, no? When the patient um, becomes an adult, no, the health service delivery system must be able to ensure that services are continued or still accessible to that person. And when that person reaches elderly, becomes an elderly, the services must also be made available with consideration to the needs of that patient as he or she goes through the life cycle. The fifth attribute is quality, and we will be talking more about this later on. But basically, it's about being able to provide effective, safe, patient centered services given in a timely fashion. The sixth attribute, which is person centeredness, is very much related to quality, wherein the users perceive health services to be responsive and acceptable to them. The seventh is coordination, wherein the patient's primary care provider facilitates or able to navigate the patient through the needed services so that the patient will not get lost, no? When he or she access the service delivery. And then finally, accountability and efficiency, wherein the core elements of these services are achieved with a minimum wastage, and that managers, people who are managing the services, have necessary authority but are held accountable for performance and results. So the eighth attribute um, touches also on leadership and governance. Now, there are five health service delivery indicators. No? These are the measures that we use for us to define or for us to evaluate easily health service delivery. However, it's important for us to be aware of that there are different indicators, no, as we go through, as we study through uh, services over the years. There have already been other indicators proposed and studied. However, I would just like to focus on or limit our discussion on these five service delivery indicators from the World Health Organization. So the first service delivery indicator is service availability. So it just refers to physical access, no, having the service or not. Okay, so examples for these measures include the number and distribution of health facilities for the particular population, or the number and distribution of inpatient beds for a particular geographic location. So actually, this one thing that we can deduce from this is service availability is just it basically just talks about the presence or absence of services. So more or less, it does not dwell really on the quality of the services yet. But later on, you will see that service availability is actually a prerequisite for quality. So having the service or not is already an important consideration, first and foremost. Okay? The second indicator would be general service readiness. And this talks about general capacity of health facilities to provide health service. So basically, it focuses on the core set of items that must be present and functioning in the facility. So examples for measures for this would be the proportion of health facilities that meet basic service capacity standards in a given locality. So actually, there are five basic capacity components or the core, no, the set of core components that is required for each health facility. Okay, so we will go through these five basic capacity components. The first would be having basic amenities. And when you talk about basic amenities, this would require regular water supply from a source on site or within 500 meters, no, having sanitary facilities, having a waiting area protected from sun and rain, having communication equipment in the facility, and having electricity during service hours. So they said that these are all basic, meaning even your barangay health center should have these basic amenities. Another core or part of the core of this basic capacity would be having the basic equipment. So this would include your adult and pediatric weighing scale, thermometer, stethoscope, BP cuff, refrigerator for your vaccines, and then needles and syringes for you to deliver your vaccines and other medicines. So again, these are basic equipment that the health facility should have. And then third of the five would be infection control. There should be a functioning sterilization equipment with power source for the method. No? So it actually will not require all the barangay health workers or all the barangay health centers to have an autoclave, but actually they should have a method, no, of sterilization present in the facility. Of course, it would depend on what kind of services that they should have. But they should have a way, a functional way of sterilizing their equipment. There should also be written guidelines or protocols for infection control. There should be sharps container or box, and there should be soap, disinfecting solution, and gloves and water for infection control. So very, very basic. Okay. The fourth, of course, is the health facility should have human resources. There should be minimum staffing requirement according to the national guidelines, no, with qualified staff. So here comes in your desired or your recommended proportion of number of doctors for certain population. No? So for doctors, we would want to have one doctor for every 20,000 population. So if the population in a certain barangay is actually 50,000, then you need to have 3 doctors in that barangay. Okay? For nurses, you need one nurse for every 10,000 population. No? And for barangay health workers, we would want one barangay health workers for every 20 to 25 households. Okay? So one BHW should only be handling 20 to 25 households or families. And the proportion of health workers present on the day of assessment should also be adequate. And then the fifth core component would be having tracer drugs and diagnostics. And the availability of these tracer drugs, we have to make sure that they are not expired. And there's a capacity to obtain basic laboratory results within 1 day. Okay, so if the health facility is accredited to have laboratory results, then the laboratory results should be available. The results must be available within 1 day. So, many of our barangay health workers or barangay health workers are not able to do laboratory results, but at least at the rural health unit, you can see or you can avail of basic laboratory tests. And these are made available because municipal health offices, or the rural health units, can also employ medical technologists, okay, registered medical technologists. So those are your 5 basic capacity components. For the third service delivery indicator, we also look into service-specific availability. So we have talked about the general, uh, services availability. Now, service-specific availability, and this refers to whether or not a specific service is offered. So we all know that we have certain priority programs, such as maternal and child health, control of infectious diseases, and also control of non-communicable diseases. So we also look into the availability of these services in a particular health facility. And then the fourth is service-specific readiness, wherein you look into the capacity of health facilities to provide a specific service. So for Roman numeral number 3, we look at the availability of that specific service. For Roman numeral 4, we also need to look into the readiness of the health facility, whether or not they can provide the actual specific service. And so, we also look into this service specific readiness in terms of the presence of amenities, equipment, infection control, human resources, tracer drugs, and diagnostics that are dependent on the specific program or specific service that we are looking into. And then finally, the fifth indicator would be service quality or quality of care. Now, as I've mentioned, quality of care is a very dynamic concept nowadays. It is multidimensional. There are several aspects that you should look into for you to say that, or for you to really measure quality of care. However, important to note that prerequisites to this are actually the first two, indicators, which are availability and capacity or readiness to deliver the services. So it's important for us to realize that if the minimum standards are not fulfilled, definitely quality is bound to be poor. And also, service quality refers to the extent to which healthcare services that were provided improve desired health outcomes. So it also talks about effectiveness. Okay, so different dimensions of quality of care include safety, effectiveness, being timely, efficiency, having the services that are equitable and people-centered. So I have provided here the definition, for the different dimensions of quality of care. As I've mentioned, safety, it's about delivering health care that minimizes risk and harm, preventing injuries and errors. Um, Timeliness refers to reducing delays. Okay, that's why you want the services to be accessible, and affordable. Okay, and there's no barriers for them to access it. The third is equitable, delivering healthcare that does not differ in quality according to personal characteristics such as your gender, your culture and religious beliefs. So, effective in terms of quality of care means that you provide services based on scientific knowledge and evidence-based guidelines. So that's why it's being taught to you how to do evidence-based medicine, because through evidence-based medicine, we can more or less say that what we are doing for the patient or the interventions that we choose are actually effective. Efficient means that we deliver healthcare in a manner that maximizes resources and avoids wastage. And then finally, again, people-centered care refers to care that is focused and organized around the health needs and expectations of people in the communities rather than on diseases. So, in short, quality of service actually refers to the level of outcome where patient satisfaction is the main aspect in judging by the services provided by the health providers. Okay? So, how well a delivered service satisfies the client's expectation. So, if the client is happy or if the patient is happy, then you can say that you're able to provide good quality of care, good quality of service to your patient. Now, as I've mentioned, aside from the first five indicators, there are also newer concepts that are being discussed in terms of how do we measure service delivery. So, one important concept is service utilization, wherein we measure the use of the available services by the general public. So, you do not only look into the services from a supplier side, but you actually evaluate services based on based on those who access the services or the demand side. So examples that we can use uh, in measuring service utilization would be the volume of patients at a given facility, the number of visits to health facilities for ambulant care, the average length of stay in a hospital or facility, and also bed occupancy rate. How many patients would like to be admitted under your care? So that's included in service utilization. Why is this important? Um, as I have engaged several communities, it's the usual response of health workers when we see low patient census, is that because the patients are tamad. The patients uh, are matigas ang ulo. They do not want to access. Um, they have poor health-seeking behavior. But actually, studies have shown that otherwise, low rates of service utilization are actually indicative of poor availability and quality of services. People do not want to access services because they do not feel that they are served well. No? They do not feel that there's good quality of care in that health facility. And several studies have also demonstrated that, for instance, OPD rates go up when constraints to using health services are removed. No? For example, when you bring the services close to the people or when you reduce user fees. So if you want to improve service utilization, you then have to look into how to improve services, how to improve the quality, the accessibility of your services, the affordability of your services, so that you can get people use the services that are available. Now, so after we have discussed the different indicators and the different attributes of a good health service, so I want you to now watch a documentary made by GMA. So it's entitled Philippine Agenda Kalusugan. So it's in Filipino. So I hope that everyone is good or understands Filipino, and you can access this documentary in this YouTube link. So this is the video is around 30 minutes. So you will have an idea of how it is here in the Philippines, when we try to access health services, especially in rural areas. So after you have watched the video, please go back to this discussion. Okay, so after watching the film or the documentary, the main question that I would like you to reflect on is this, So why do we have such condition in our health service delivery? Okay, so the answer to this can be very much complicated, but at the same time, very much straight to the point, very much simple. And why do I say so? So in this framework made by that you can see in the WHO World Health Report in 2000, there are you have the different factors or the different building blocks of the health system, and it shows how each building block relates to each other. what can we see here is that your service provision is affected obviously by the amount of financing that you have, the resources that you have. However, it's also affected by stewardship. Okay? And this delivery of health services, we all know, would result to the health outcomes that you will see, that you will observe. So what's the message here? Okay? The message here is that stewardship or oversight is a very important determinant of your health services. I'm not sure if you have observed in the video, but the role of leadership and governance really is very important in terms of designing, in terms of making the services available to the patients or to the communities. So having said that, let's talk about stewardship. No? So stewardship is a broader version of leadership. Okay, and what does it mean? It's the careful and responsible management of the well-being of the population. It's actually they consider it to be the very essence of good governance. And at the end of the day, it is the government that is ultimately accountable for the effective undertaking of the stewardship function of the whole country. In the World Health Organization, they have described well, no, what do we mean when we say health system stewardship. They said that actually health system stewardship consists of three types of stewardship. The first is stewardship in health, wherein you look into leadership in the health sector. The second is stewardship of health, that involves strategic management of the health system. And the third is stewardship for health, that is the strategic management of the intersectoral, socio-political, and environmental factors. So stewardship in health, meaning leadership in the health sector, will actually mean stewardship in financing, in resource generation, and in health service provision. And therefore, the task of leaders, no, of health leaders, when we talk about stewardship in health, is first, organizational and regulatory environment for effective and equitable financing, no? Being able to provide that kind of environment for effective and equitable financing. Being able to develop, produce, no, and distribute resources, and making sure that that system is effectively carried out. And then finally, they should be able to ensure services, no, that were provided are in line with national policies and plans. So that's about stewardship or leadership or management of the health system. However, as I mentioned, there's also this second aspect, which is stewardship of health. And it entails developing a vision and setting policy direction for health development, deciding how the health system should evolve to corresponding changing in environments, and establishment and maintenance of the health system's organizational and institutional framework. So it's actually going outside the confines of the health system and really taking into consideration how health would fit in the whole system of governance. And then finally, stewardship for health. And that's strategic management of the intersectoral, socio-political, and environmental factors. Stewardship for health is actually, I think personally, the most challenging part, because in this aspect of stewardship, you need to influence the broader environment in wherein the health system operates. So you have to have influence in terms of the policies on factors with secondary health enhancing effect, such as education, environment, agriculture, etc. So in short, Stewardship for health requires you to look into the social determinants of health. Okay? So, when we talk about health system stewardship, no, or leadership, it's not only about managing the health system. It's also about looking into how your health system will figure in, no, in the national level of governance, how your health system can contribute to national development, and of course, it also requires stewardship for health, wherein health is included in all aspects of the society. But of course, we all know that being able to do these things are very difficult. You need to have enabling mechanisms. You have to have these conditions so that you can actually provide effective stewardship. And this would include peace and security in the area, continuity in health policies and personnel, and institutional arrangements in ministries of health. There should be coordination and participation of partners in the implementation of health policies and plans, participation of civil society in improving the design and implementation of public programs, evidence-based decision making. There should be transparency and accountability, and finally, there should be intersectoral collaboration. So it's really difficult, no? If we talk about health services only, and if we will not try to understand how health services, no, or the factors that would affect the delivery of health services would come into play. So it just shows us how interconnected these different building blocks of the health systems are. Okay, so for us to facilitate the integration of the different things that we have talked about today, I would like again to request you to answer the question that I have posted in this link, no? Or you can scan this QR code, and then again, automatically your responses will be submitted to me. Okay, so I hope you're able to gain a lot, no? Or at least you're able now to um, have a deeper understanding about health service delivery and the factors that affect, no, uh, the quality of services that we're able to provide. Um, I end with this. No, I know it's difficult time, but I have seen this message in Facebook, and I really like the message from Pope Francis. So sabi ni Pope Francis, tonight before falling asleep, think about when we will return to the street, when we hug again, when all the shopping together will seem like a party. Let's think about when the coffees will return to the bar, the small talk, the photos close to each other. We think about when it will be a memory, but normalcy will seem an unexpected and beautiful gift. We will love everything that has so far seemed futile to us. Every second will be precious, swims at the sea, the sun until late, sunsets, toast, laughter. We will go back to laughing together, strength and courage. See you soon. So just like what Pope Francis said, see you soon for our presentations, our researches, and COP projects. So anyway, for now, these are the references that you can look into if you want to know more about the topic. No, and I encourage you to actually read, especially the part on here, the publication of the World Health Organization in 2002. So that talks about health sector reforms, the role of stewardship role, and I think the rest of the materials you have already came across with during the different modules that we have in HSM. Okay, so thank you very much. Stay safe and hope to see you soon.